Hello dear patients and our followers. I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul, Turkey. Today we are going to share with you a different case. Today we have a female hair transplantation case, evaluation of the case and the results of the surgery. There is a very big misconception thinking that the hair restoration surgery or hair transplant surgery is mostly used for the men. Yes, and most of the procedures we perform are done on men patients, but there is a very big group of the patients in females as well. Unfortunately, in almost half of the patients, female patients over the age of 40, we can see a degree of the hair loss. Today, our patient is a 34-year-old female patient with a unique type of the hair loss. It's a traction alopecia. Traction alopecia is widely seen across the female patients. Traction alopecia happens when a very tight hair stylings like ponytails, dreadlocks are used in females. It causes traction of the hair root and its blood supply is compromised, and all the time the hair becomes thinner, thinner, thinner. And there is a very unique pattern. You can see the shade of the hairline. It's not completely gone, but it's almost empty. There are some like baby-like hairs. The traction alopecia is seen in many of the females, but it specifically can be seen in afro pattern of the patients because the hair is slightly thicker, tighter in them, and they use very tight hairstyles from very early age. So as we have mentioned before, a 34-year-old female patient with a traction alopecia. As you can see, as we have mentioned here, actually, the patient has preserved the frame of the hairline, but it's a thin and there are baby-like hairs in this area. When we are designing the hairline, most of the time for the females, we try to preserve their own hairline. The female hairline has some unique features that is really different from male patients. One of its features, it's slightly more rounded on the corners. It has an inverted S features on the corner. And one of the most important features here is that it's a very multi-directional. In men, we have a specific direction, but in female patients, the direction may be really different. And when we are designing it, the oval shape, staying above the forehead muzzle, rebuilding the inverted S, giving it a more feminine lines, and the most important, adjusting the directions accordingly and correctly have a very big impact on the final outcome. And as you can see here, we preserved the front hairline of the patient herself. We didn't change it, we just reinforced it, reconstructed it, marked the areas that needed to be transplanted. And one of the important features here, we also marked the direction of the hair, how they grow and how they're distributed. So when we are doing the incisions, the turn from one side to the other side goes really smooth, so it looks natural, not showing off that the patient had the hair restoration surgery. So feminine hairline, preserving the hairline. The best option is always to rebuild the hairline at the level the patient had, so it looks much more natural. Its direction is very important. So the patient went surgery with 3,200 grafts. Because it's a front hairline and it should be with slightly higher density, and the corners specifically are really widely receded on temples, we did the planning and with the high number of the grafts for the patient. Now we can see a 1-year result of the patient. The donor area has completely healed, recovered. The sides at the areas where the transplantation is done, you can see the grafts are growing in the correct direction. So even though when she makes the hairstylings, make a ponytail or push the hair to the back, you can see the hair starts with some unique thinning we see in most of the females and in man patients as well, and goes slightly thickening to the back of the head. So the restoration of the front hairline or revision of the front hairline is done. The adjustment of the density is done. The patient is happy and it's really good result. We can see it from the front hairline that the frame of the face is also restored and the thin and receded hairline is completely rebuilt. The patient is happy, we are happy. It's one of the examples when the hair transplantation surgery may have a dramatic effect or dramatic results, changing the life of the patient, making their lifestyles, their self-esteem really good. And it also ruins one of the dogmas saying the hair restoration surgery is only for men. No, the hair restoration surgery or hair transplantation surgery can also be applied for female patients as well, and we have really good results with it. With the correct planning and correct pick up with the patients and the surgery. Stay tuned. Thanks for watching and see you.